A 4-year-old boy presents with recurrent skin abscesses and pneumonia. He has a history of infections with Staphylococcus aureus and Serratia marcescens. A dihydrohodamine, DHR, test shows decreased green fluorescence in neutrophils. Which of the following is the most likely underlying defect? A. Deficient myeloperoxidase. B. Defective NADPH oxidase. C. Absent CD18 integrin. D. Deficient adenosine deaminase. E. Defective lysosomal trafficking regulator. Lactancer. B. Defective NADPH oxidase. Explanation: CGD is caused by a defect in NADPH oxidase, which impairs the respiratory burst in neutrophils, reducing reactive oxygen species like superoxide. The DHR test is abnormal in CGD. Why not the others? A. Myeloperoxidase deficiency causes recurrent candida infections but has a normal DHR test. C. CD18 deficiency, leukocyte adhesion deficiency, LAD, presents with delayed umbilical cord separation and no pus formation. D. ADA deficiency causes AD with severe lymphopenia and opportunistic infections. E. List defect, Chediak-Higashi syndrome, presents with albinism and giant granules in neutrophils. Question 2. Which of the following organisms is a patient with chronic granulomatous disease, CGD, most susceptible to? A. Streptococcus pneumoniae. B. Listeria monocytogenes. C. Escherichia coli. D. Staphylococcus aureus. E. Cryptococcus neoformans. Correct answer, D. Staphylococcus aureus. Explanation: patients with CGD are especially susceptible to catalase-positive organisms like S. aureus, Serratia, Nocardia, and Aspergillus due to impaired intracellular killing. Why not the others? A. S. pneumonia, catalase negative, not a typical pathogen in CGD. B. L. monocytogenes, not a catalase-positive organism typically seen in CGD. C. E. coli, while gram-negative, it is not a common pathogen in CGD. E. Cryptococcus, fungal pathogen, but not commonly associated with CGD like Aspergillus is. Question 3. A laboratory is evaluating neutrophil function in a suspected immunodeficiency. The nitroblue tetrazolium NBT test fails to turn blue. What does this indicate? A. Defective chemotaxis. B. Deficient catalase production. C. Deficient oxidative burst. D. Deficient major histocompatibility complex class 2. E. Hyperactive phagocytosis. Correct answer, C. Deficient oxidative burst. Explanation: a negative MBT test, no blue color change, indicates a defective respiratory burst, consistent with CGD where NADPH oxidase is dysfunctional. Why not the others? A. Defective chemotaxis, seen in LAD, unrelated to the oxidative burst or NBT test. B. Deficient catalase production. The problem in CGD is susceptibility to catalase-positive organisms, not lack of catalase. D. MHC class 2 deficiency causes Bayer lymphocyte syndrome, does not affect neutrophil oxidative burst. E. Hyperactive phagocytosis would not cause a negative MBT test. This is not seen in CGD. Would you like